Hi everyone, I'm Valeria Urbano from the Department of Management, Economics and Industrial Engineering of Politecnico di Milano. Today I will introduce our study on determinants for sharing citizens' location data with public institutions in pandemic context, and specifically I will talk about Italian case. Submission number for Data for Policy 2022 is 8028. And I will introduce this research study on behalf of me and my co-authors Federico, Bartolomucci and Professor Giovanni Azzone from Politecnico di Milano. Briefly going through today's agenda, we will tackle the importance of location-based services during COVID-19. I will introduce the objective of the study, so the specific research questions we address through this study, the research framework we adopted, the methodology we relied on, and the results and conclusions of the study. Starting from the relevance of the topic, the COVID-19 pandemic has brought many states and many governmental agencies to put in place unprecedented containment measures, including contact tracing apps. Contact tracing apps can be designed according to two main technical configurations, the GPS and the Bluetooth. The first type collects location data, while the second one leverages on encrypted tokens to track proximity between individuals. For contact tracing purpose, the two configurations can be considered as equivalent. However, the usage of mobility data supports the investigation of spatial heterogeneity in the spread of virus, so can provide the relevant insights for policymakers for designing and developing a tailored and effective intervention and plan of actions. Despite most of the countries, Bluetooth technology was adopted to increase the willingness of citizens to accept and to download these contact tracing apps. Only 35% of the countries have reached the threshold of 20% of penetration rate, at which simulation research studies show that first positive impacts on the reduction of transmission can be seen. This topic and ineffectiveness of tracing apps in limiting the spread of COVID-19 influenced our interest towards these factors that influence data sharing initiatives during COVID-19 outbreak. And this is a research area that has recently drawn the attention of several research groups. However, the ineffectiveness of tracing apps in limiting the spread of COVID-19 have been investigated mainly by looking at one single factor, such as incentives, technical factors, or privacy concern. There was no distinction between Bluetooth and GPS technology. And moreover, authors investigated the adoption of contact tracing apps developed to contain the COVID-19 spread rather than the willingness of individuals to share their personal data. So adopting this latter perspective and trying to understand what are the factors that influence the willingness of individuals to share their personal data, this research study aims at answering to two main research questions. The first one is, to what extent is trust in public institutions related to citizens' intention to share their location data with them? And the second research question is, to what extent are the perceived benefit and perceived risk of sharing location data related to citizens' intention to share location data with public institutions? So we wanted to investigate determinants for sharing citizens' location data with public institutions in pandemic context, and specifically we analyzed the influence of citizen trust in the organization that collect data, in this case public institution, and the positive trade-off between perceived benefits and perceived risk on individuals' intention to share personal data. The research framework we adopted, we started from two models, the antecedents, privacy concerns, outcomes, APCO model, developed by Smith and other authors in 2011, and the theory of reason action, developed by Fishbein and Eisen in 1975. The first model, referred to as the antecedents, privacy concerns, outcomes model, link the citizen privacy concern in disclosing personal information with its antecedents and outcomes. While the theory of reason action explores the relationship between the actual behavior of individuals and the intention to perform that specific behavior. And this model assumes that behavioral reaction is comparable to the intention of citizens in disclosing personal information with other parties. Through hypothesis number 1, hypothesis number 2, and hypothesis number 3, we tested the influence of trust in public institutions and perceived privacy benefits and perceived risks on the willingness of citizens to share personal tracking data. For hypothesis number 4 and hypothesis number 5, we considered the existing literature that supported the mediating role of perceived risk and perceived benefits in the relationship between trust and behavior, and we posit that the level of citizen trust in public institutions negatively influenced the risk that citizens perceived in sharing tracking data and positively influenced the benefits that citizens perceive in sharing tracking data. Finally, for hypothesis number 6, a previous study posited a relationship between the perceived risk and the perceived benefits. Perceived risks, more specifically, can negatively impact on the individual perception of the benefits perceived in sharing tracking data. Moving to the methodology, we use an explanatory survey. We develop our instrument, our questionnaire, on the basis of privacy literature with a specific focus on tracking data. So literature about tracking data sharing with service provider. We measure trust as a multidimensional construct that includes ability, benevolence, and integrity. Ability refers to the set of skills a trustee has in managing the data within a specific domain. Benevolence refers to the perceived willingness of a trustee to pursue the trustor's good aside profit. Integrity refers to an organizational adherence to predefined rules acceptable to both trustee and trustor. As the focus of this research study is the willingness of sharing tracking data with public institutions in the emergency context, the benefit involved the provision of a service that prevents the spread of infectious disease. Risk is measured through a single-dimensional construct that measures the potential loss of control over personal data. And the intention of sharing tracking data is a monodimensional concept that is measured through a scale that expresses the likelihood of data disclosure. All the measures are measured, all the items are measured through a 7-point Likert scale. This is because our higher reliability and stronger correlation was proven with t-test when using a 7-point scale. And moreover, most of the empirical study in this research area adopted a 7-point scale, so this would make the comparison, will facilitate comparison of results and reliability with studies that use the same scale. Following the APCO model, the target population has been selected with fixed privacy concerns antecedents. We fixed demographic differences and culture to minimize the influence of privacy concern on trust and privacy risk. Therefore, the target population of this study is represented by Italian undergraduate students, Italian students. Enrolled in Italian university. Moreover, the discrimination of the target population was further supported by the use of control variables, privacy awareness, privacy experience, and personality differences, which may influence the privacy concerns and have an impact on trust and perceived risk, according to the APCO model. Moving to the results part of this presentation, first, we assess the quality of our measurement model. We first evaluate the reliability of single items, and we confirmed the relationship among the observed variable and the latent construct: trust, privacy benefits, perceived risk, intentional reaction. In order to evaluate the individual item reliability, we performed a confirmatory factor analysis. Looking at the loadings of the single items on the respective constructs, we noticed that all the loadings are above 0.5. So the reliability of the items included in the model was validated. We also evaluated discriminant validity and internal consistency of our measurement model. For discriminant validity, we refer to the degree to which measures of different constructs are distinct items, loaded more highly on the intended constructs than any other constructs. So we analyzed the square root of the average variance extracted, AVE, between a construct and its items, and we noticed that all constructs share more variance with their indicators than with other constructs. So we can see on the diagonal of this table that the square roots of the AVE demonstrates that these values are all higher than the correlations. So the requirements of discriminant validity for the items of this model are met. Moving to internal consistency, we measure how well the items used for one construct correlate or move together. And to evaluate internal consistency, we look at composite reliability and Cronbach alpha. The overall Cronbach alpha is 0.73, and all the measures of composite reliability are close to the recommended value of 0.6. So the requirements of internal consistency for the study are met. Results of the study: to test our hypothesis, we analyzed the sign and the significance of the path coefficients in the structural model. We evaluated the structural model by conducting the statistical test at 5% level of significance and including the control variables that were introduced before. Control variables had no statistically significant effect on the intention to disclose personal tracking data, and the structural model explained 46.2% of the variance in intention to disclose personal tracking data. Looking at specific hypotheses, the citizen trust in public institutions, the perceived benefits and the perceived risks are a significant predictor of the intention to disclose personal tracking data. So we validated hypothesis number 1, 2, and 3. By looking at the goodness of fit of the model, we noticed that the perceived benefits and perceived risk can explain more than 35% of the variance of the dependent variable, while citizens' trust in public institutions was able to explain only 16% of the variance of intention to disclose personal tracking data. And this reveals the importance of perceived benefits and perceived risk when compared to trust in public institution. The role of trust, moving to the hypothesis number 4 and number 5, the role of trust and perceived benefit and perceived risk were confirmed by the results of the analysis. So citizen trust in public institution positively influenced the perception of usefulness of sharing and tracking data, and negatively influence the perceived risk in sharing personal tracking data. So the hypothesis number 4 and number 5 were validated by this empirical analysis. The influence of perceived risk in disclosing personal tracking data on the perceived benefits was also confirmed by the analysis, so we also validated the hypothesis number 6. We also wanted to gather further insights on the interdependence between the investigated variables. So we conducted a post hoc analysis to investigate the potential mediating effects of perceived benefits and perceived risk in the relationship between trust, perceived risk, and the intention of sharing personal tracking data. Looking at the results that are shown in this table, we can see that perceived benefits, so perception of usefulness deriving from the sharing of personal location data, positively mediates the effect of trust on the intention to share personal tracking data, and negatively mediates the effect of perceived risk on the intention to disclose personal tracking data. The negative effect of perceived risk on the relationship between the citizen trust on public institution and the intention to disclose personal tracking data was also confirmed by the analysis of mediating effect. And trying to quantify the mediation role of these variables, we examine the variance accounted for, VAF, of the mediating variables, and this analysis revealed that VAF is greater than 20% for the three relationships, so we confirm partial mediation in the three investigated relationships. Last, I will introduce the implications of the studies, focusing both on theoretical and practical implication. From a theoretical perspective, the results show that both perceived risks and perceived benefits determine the willingness of individuals to share personal tracking data during COVID-19. Analyzing direct and indirect effects of these determinants on the dependent variable, it was also possible to investigate the mediation effects of factors by evaluating the strength of this path. Moving to the practical perspective, this study has implication for public institutions and governmental agencies in their attempts to incentivize the disclosure of personal tracking data. This study enhances the ability to understand, predict, and control the social acceptance of services that exploits location data to manage emergency situation. More specifically, looking at our findings, the results of the study revealed that the effect of perceived benefits and perceived risk on the intention to share location data is higher than trust. So this finding invites policymakers to focus their efforts on strengthening communication strategies to show the potential benefits deriving from the sharing of location data in order to increase the perceived usefulness. On the other side, it invites policymakers to put in place actions to reduce the effective and perceived risk connected to data sharing. One example of a strategy could be to include informed citizens representative in the design and implementation of technological solutions in order to decrease the perceived risk, especially during emergency situation. This is the list of references, and thank you for the attention, and see you in Seattle for the Data for Policy conference. Thank you.